Welcome, everyone, and thanks for joining. My name is Sydney Cooper, and I'm the events moderator here at Health in Her Hue, and I'll be your host today. Our community conversation, powered by Aveeno, will be focused on sensitive skin and eczema. Eczema is the second most prevalent skin disease to affect Black Americans, but it's often misdiagnosed and untreated. This is why we've collaborated with Aveeno to bring you tonight's conversation. Aveeno has made a multi-year commitment to bridge the skin health equity gap by creating awareness and providing resources for adults, children, and babies. In 2021, Aveeno introduced the Skin Visibility Program and provided equitable access to educational tools, resources, and products for sensitive skin and eczema diagnosis and care for Black skin, pledging to help 100,000 sensitive skin sufferers to find relief. As a reminder, Health in Her Hue is a digital health platform that connects Black women and women of color to culturally sensitive healthcare providers and offers health information and content that centers their lived experiences. We have a very special guest with us today, and that is the brilliant Dr. Kiana Williams. Dr. Williams is head of the Skin of Color section and staff physician in the section of micrographic surgery and cutaneous oncology in the Department of Dermatology at Cleveland Clinic. Dr. Williams received her Bachelor's of Science degree in Human Physiology, graduating magna cum laude from Boston University, and received her medical degree from the University of California, San Francisco. Dr. Williams completed a transitional internship at St. Joseph Mercy's Hospital in Ann Arbor, Michigan, and a residency in dermatology at the University of Michigan, followed by her fellowship in micrographic surgery and cutaneous oncology at Cleveland Clinic. Dr. Williams is a fellow of the American Board of Dermatology. Her special interests include Mohs micrographic surgery, skin of color, and cosmetic dermatology. Dr. Williams has been involved extensively in medical education, mentorship, and diversity, equity, and inclusion initiatives. Welcome, Dr. Williams. We are very excited to have you today.
Thank you. Thank you. When you list it out like that, it sounds like I've done a lot.
You have.
Long.
We have the perfect expert then for today's conversation. But as a reminder for our audience, even though she is a doctor, this is not medical advice, so please seek personalized care for any individual concerns. Okay, so we're going to jump right in because we have a lot to get through.
Yeah.
What would you consider sensitive skin, and what are the different types?
Yeah. So I think sensitive skin, that it's kind of an umbrella term, right? Because people with eczema also have sensitive skin. But generally speaking, the way I think about sensitive skin are people who have skin that they can't necessarily use anything, right? They have to be very careful, whether that be they can't use certain fragrances, or if they use certain lotions, things like that, they have a reaction to it. And a reaction doesn't necessarily always mean a rash. It could just mean that like it's itchy or, it burns, things like that. So people with sensitive skin, generally speaking, have to be a little bit more careful and a little bit more selective in the things that they're using. And then eczema is, that goes a step farther where you have some break in the skin barrier. And so that's like kind of sensitive skin, but like on the more extreme end.
Got it. Okay, that makes sense. So anyone really can have sensitive skin is what it sounds like.
Right. You don't necessarily, if you have sensitive skin, that doesn't mean that you necessarily have eczema. And sometimes it can also be site specific. So some people, their face may be particularly sensitive, but they can put anything on their body. Thinner skin tends to be a little bit more sensitive. So that tends to be the case.
Got it. Okay. Well, then what would make someone more susceptible to having sensitive skin?
So a part of it, and I always tell people that, dry skin rashes, meaning that, if we're not hydrating our skin well, all of us as we get older, our skin is getting drier and drier. And that also depends on like the climate that you're in. And so there's a few factors that kind of contribute to having sensitive skin. One, if your skin is just more naturally dry, or if you're not moisturizing it very much, the climate that you live in can also make it more dry. Genetics play a role too. It's not uncommon that if you have sensitive skin, other people in your family have sensitive skin as well. And then your job too, if you're exposed to more things, more like contact allergens, things like that, then you can be more likely to have sensitive skin.
Got it. Okay. That makes so much sense because I think sensitive skin runs in my family. A lot
Yeah.
of us have certain skin conditions, including eczema.
Yeah.
But also I grew up swimming, so I was in chlorine twice a day, and over time, it just got progressively worse. That
Mhm.
makes a lot of sense.
Yeah.
So, is black or melanated skin more likely to be sensitive?
So not necessarily. I mean, if you're talking about eczema specifically, there is a higher prevalence of eczema in Black patients, but that doesn't necessarily mean that sensitive skin is higher in Black people. It's I guess the answer to that question is like not necessarily.
Okay. Okay, so it doesn't necessarily have to do with, like, melanin or, like,
Right.
that our skin is a different color.
Right. Right.
Got it, okay. So you mentioned eczema, which is different from sensitive skin.
Mm.
How does eczema present in black skin or skin of color?
Yeah. So I think this is like one of the parts that they're like the key here is because, eczema can look very different in different skin types.
Yeah.
So when you have darker skin, one, there's actually different types of eczema that you see more. Patients of color, but patients with black skin tend to have more, they can have more papular eczema. So what that means is almost like smaller little dots,
Okay.
or it can almost be like follicular based. So if you were to look at like, all the little hairs, like, on your arm or whatever, you might see there's kind of like a dot in every little hair. So that's one part of it is it can be kind of more like bumpy and a little bit kind of rough. Another thing is people like these pictures that you often see of eczema, often they're of white skin and it shows like redness,
Yeah.
right? And redness is harder to appreciate in darker skin. So it might not necessarily be redness. In fact, it can actually be instead like hypopigmentation. So there can be areas that are lighter, or you can have hyperpigmentation. So it can be areas that are darker. And that's because, we have melanated skin. And so what can happen whenever there's inflammation around those melanocytes, which are the cells that make up pigment, it can either excite those melanocytes or get them to calm down. And then we can see color changes in that way. But appreciating redness might be a little bit more difficult.
Got it, okay. I swear I wish that I had access to this information growing up. My sister has eczema, and she went years without a diagnosis, and everyone just said that she had super dry skin, like the
Right.
chlorine or because of the chlorine, but it was very different from the dry skin that I was experiencing. And she didn't have a provider of color or one that was more, sensitive to dealing with black skin or melanated skin,
Yeah.
and she went years without treatment, just, like, trying to figure out small tips and tricks that she could pick up or, like, figure out on her own just to alleviate some of her issues.
Yeah, and it's a huge problem because I mean, the longer you have eczema and it goes untreated, the more likely you are to have some level of like scarring or dyspigmentation as a result of it. So, and it's also just kind of miserable to live with, right? It's like sometimes it's in places that, can be embarrassing, or it's just like really itchy and it can be painful because you scratch it so much and then it bleeds. It's like
Yep.
it can get super infected. Like it's like this the whole like snowball effect, really.
Yeah, and even when it pops up on, like she experienced it on her scalp, and,
Hmm.
like, I know that was so painful for her because it's flaking, like and I'm sure it was embarrassing at the time.
Yeah.
There's less of a stigma around it now, but, like, if you get flaky skin or, like, flaky patches in areas that are super visible that you can't cover up as much, like, that has to take a toll on your mental too.
For sure, for sure. And I mean, and we know this, right? Like we know that skin conditions have a huge impact on people's quality of life. And it can go as far as like impacting their likelihood to, like apply for jobs or like be outgoing. Like it can affect their social life. So there are huge implications to this, and it's a real problem.
Yeah. So, when should you see a dermatologist for your skin if you think that you might have sensitive skin and or eczema?
Mhm. So, I mean, I feel like a broken record because I always say this in that, my threshold for seeing a dermatologist is very low. There's so much misinformation out there, whether it be you just walk into Target or Walmart and you start looking at these things, like they all promise like fantastic skin and you spend all your money, you try them, whatever. So I would say, from that there's misinformation, and then online social media platforms, there's a lot of misinformation out there. And so I say, the threshold is generally low, but certainly if it's ever getting to a point where you're just feeling like you can no longer control it, or if you're just no longer sure, like, what is the right thing, right? I saw this one thing that told me to do this thing, I saw this other thing that told me to do that. If you're having those questions and you really just want, like, okay, what's the truth, like, what should I really be doing, then
Yeah.
it's time to see a dermatologist.
Okay, that's such good advice because even during the pandemic, skincare TikTok got very popular because we didn't have a ton of things to do in our free time. So we all hopped on this skincare wave. And I
Mhm.
just remember trying out different things out of boredom, I'm sure, that ended up harming my skin so much more than if I
Right,
had just left it alone or seen a
right,
professional or like tried quality, tried and true products. So yeah,
yeah,
I'm so glad that you said that.
yeah.
Yeah, there was a lot of, none of them made them to social media, thank goodness. I didn't try to, like, go be a skin influencer because I had no idea what I was doing, so, okay, so I in between seeing a dermatologist or while you wait for an appointment to get one or while you wait to find, the right one for you, what are some resources that someone could use to see what different skin conditions look like, on sensitive Black skin or sensitive skin of color?
Yeah, so there are various skin of color atlases. In fact, one is called Skin of Color Atlas.
Mm.
DermNet NZ also has photos and kind of brief explanations of various skin conditions. And then Aveeno, actually, they also have several photos, and they made a point to make sure that they're including, black and brown skin, because the issue, historically has always been that if you were to open any dermatology book or these resources, it was always examples in white skin, which, like we talked about earlier, can look very different. So Aveeno has actually done a really great job of making sure to include brown and black skin in their examples of sensitive skin and eczema.
Oh, shout out to Aveeno because they are tried and true,
Honestly,
and
they're great products, truly.
yeah, and now, like, really focusing I mean, I'm sure they have been, but I'm really glad that we're highlighting their focus on skin of color because we need more representation and more care directly for us, so really appreciate them.
Yeah, for sure.
Okay. Can you explain the difference between what someone would go to a dermatologist for and what someone would go for to an esthetician for, when they have sensitive skin concerns specifically?
So, I think that you should first probably see a dermatologist just to get a diagnosis, because like sensitive skin is going to be different from eczema, and or different from psoriasis, or different from seborrheic dermatitis. There are various things that could be going on. So I think it is a good idea to first kind of get a baseline diagnosis, to make sure that you kind of know what it is that you're treating or trying to treat. And then, I would say after that, it just becomes a matter of, like, an esthetician might be able to help you find like certain like products and things like that that you really like using, or things that will be good for like your skin texture, or your skin makeup, meaning like if it's kind of oily or dry or whatever, things like that. But again, I think it's a good idea to see a dermatologist first.
Okay. Oh, that's such a good point. I feel like especially if you're new to the skincare game, you're not sure who to go to.
Right.
And, I don't know, I always just thought a dermatologist was, like, for extreme cases, but I'm glad that we're normalizing it and, like, making it out to be, one of, like, your core team of providers, it sounds like.
Yeah, because I will be honest though, right? It's easier to see an esthetician than it is a dermatologist.
Okay.
Like, I have patients all the time telling me, like, I waited 6 months for this appointment. Like, it takes
Mm,
time sometimes, unfortunately.
yeah,
So I get why people, go to estheticians or med spas or things like that, because they're looking for answers and they want to go to someone who specializes in that. It makes sense.
yeah.
But, of course, I've seen cases where it's like, you're using this thing, but that's you should be using the opposite, or, it's really because you have to get a diagnosis first, and the esthetician will be able to give you one.
Okay. Okay, so that's a bit of the difference. One, you get a diagnosis, and the other is more treatment and cosmetic, concerns, but dermatologists can do both.
Oh, for sure, for
Okay,
sure. Yeah, I
okay.
don't think that if your goal is to kinda, like, find out, like, every dermatologist might not know, like, the very newest, like, skincare trend, you know? So, like,
Yeah.
an esthetician might, like, perhaps there's a dermatologist that doesn't know about snail mucin, and your esthetician might know about snail mucin.
Yeah.
You know, like, other than that, though, I think a diagnosis is, like, gonna be, like, the first thing that needs to happen.
Okay. And anyone, this may be a silly question, but any age you can see a dermatologist?
Oh, yeah.
Because I know that like sometimes you're born with skin conditions and then other times they develop over time. I've heard a lot of it can come from diet. The things that you're putting in your body sometimes are directly reflected in the way your skin reacts.
Yeah, so I mean, it's not necessarily that, if you have eczema or whatever, you have food allergies or what you're eating is causing things, but there certainly is a correlation, or there can be a correlation. Like some people can say, like, whenever I eat X, like I always flare. And then, but if you're finding that you can't really find, a trigger or something that's associated, then, maybe not. But it can happen at any age, any age.
Okay. Yeah,
Yeah.
speaking of which, as I got older, I guess my digestive system is just not as forgiving, but, gluten and dairy,
Yeah.
every time, just like rashes, and I did not understand the correlation. I didn't even think that there was a correlation. I was just like, "Oh, like, maybe I'm just having sensitive skin, maybe I put something on my skin or changed up something," but for me, I realized that gluten and dairy had like a direct impact among impacting other things, but
Yeah.
yeah.
I know it's true.
Okay. So a lot of Black cultures share the practice of moisturizing our skin with butters, such as like shea butter, cocoa butter, etc., and other oils like coconut oil and olive oil, or taking oat baths to soothe sensitive skin. How do we know which of these cultural products or rituals are suitable for people with sensitive skin today?
Yeah. So now, this is very, like, person specific. So now generally speaking, I say if you have sensitive skin, if it smells pretty, if it looks pretty, you probably shouldn't use it.
Oh,
But there are caveats to that. You can have sensitive skin, but every time, you use like cocoa butter, which has a scent to it, as we know, or every time, you use olive oil or whatever, olive oil doesn't have a scent, but has a color.
gotcha.
Um, and but it doesn't bother you, or maybe it actually makes things feel better and things get better, then, like, all right, well, then that's okay for you. But some people, they may have sensitive skin, and because, like, culturally we're so used to putting like certain oils and things on our skin. This actually reminds me, my daughter has eczema, and my mother-in-law, like, kept putting this, like, super super strong oil on her. Like it smelled so fragrant, and she's like, oh, well, she has eczema, so, like, I use this for eczema. And I'm like, no, like, her eczema was like flaring and getting worse, and the more it flared, the more she put it on, and then the more it
Oh,
flared, and I was like, stop putting this on her. Like, my babe, like, I had never seen her eczema so bad. So, like, that's when I was like, all right, maybe, like, step away from a cultural norm and, like,
yeah.
like, to ask yourself, like, is this actually helping, or is this kind of
Yeah.
maybe hurting? So that's a perfect example, I think, of, a cultural norm kind of like maybe hurting us a little bit rather than helping. Um, but then oat baths actually are fantastic, because oat really does, it calms down inflammation, and that inflammation is kind of what's driving that itchiness, that irritated feeling. And then the inflammation kind of gets in this, like, this bad cycle of just, like, kind of feeding into each other, or feeding into itself rather. And so oat is fantastic, and that's honestly why Aveeno is so great. It almost has like that kind of like light oat smell because they use oat in a lot of their products. Um,
Okay.
it can be actually really soothing. And when I think about it, I mean, Aveeno, I think, has the highest, like, number of products that have that, like, oat in it to help with, soothing eczema and
Okay.
sensitive skin.
So their products are like very much science-based,
Yeah.
like, oh, I love that. Okay,
Yeah.
I was actually wondering why, because I know Aveeno is tried and true. They've been around forever. I've always wondered why they never like kind of overdid it with the fragrances and stuff, but it makes so much sense
Yeah.
because it
Yeah.
works.
And yeah.
What is some of the science behind, like, not mixing eczema and the oils? Like, is there, like, a
So
reason that you shouldn't?
Yeah, so basically what eczema, you have a broken skin barrier, right? So let's say
Okay.
like a completely like normal skin is intact like this.
Okay.
With eczema, basically what you have is you have small cracks. And so even if you can't necessarily see them, that's what's happening. There are these small cracks in the skin. So what that means is like whatever you're putting on your skin, and it can seep deeper. And
Yeah.
when it seeps deeper, it can cause inflammation underneath, which then is kind of stimulating and keeping the eczema going because that skin barrier is not completely intact. So that's why like certain oils, things that are, have fragrances or are colorful or whatever, because they're kind of penetrating that skin barrier, they have a likelihood of causing irritation and worsening eczema and sensitive skin.
Got it. Okay. And then the oat baths with oat being great for inflammation and the broken skin, it
Right.
seeps deeper and helps the inflammation. Got it. Okay. That makes so much sense. Okay. Cool, cool, cool. Yeah, because before my sister got her formal diagnosis, and even me with swimming, like we would over oil because we were dry. And logically, we were thinking, "Oh, just add more oils, just
Right.
add more." And, I've even noticed it for myself. I do have sensitive skin on my face. I
Mhm.
cannot put a lot of oils on my face. Even
Yeah.
if my skin is dry, like, I cannot overhydrate. It just doesn't work.
Yeah, for sure.
Okay, got it. Okay, so how should Black women and women of color with eczema and or sensitive skin manage their skin conditions in different climates and seasons, such as humid climates, summers, and winter months?
Mhm. So I think like mostly everyone is drier in the winter, so, now generally speaking, I don't really I think a lot of these things you should kind of do throughout the year, but your like kind of like ability to like do so or like keep up with it is gonna vary. Like, because in the summer you put on like, those thick things and you're hot and you're sweating and then it's like greasy all over and it's
Yep.
like
Yeah.
you're like staining your clothes because you're like sweating off your like body butter and whatever. So like I
Yeah.
get that. But definitely so not taking super hot showers, patting dry when you get out, immediately putting on a moisturizer. But again, generally speaking, something that comes out of tub is better than something that comes out of a pump.
Okay.
Um, Bland, so like white or like kind of tannish like color, not like purple or green or all those like fun colors, right? Exactly, none of that. The things that smell pretty bland, and then, like I said, the thicker the better.
Yeah.
Um, so you're gonna be able to put, thicker things on certainly in the winter, whereas, in the summer months, it might be a little bit harder. So it's fine to use a lighter one because we're losing less moisture, in the summer months rather than in the winter when we're all super dry. And hydrating and drinking water as much as you can.
Gotcha. What's the science behind the hot showers? Because that's gonna be hard for me.
So what it basically does is, you have more like vasodilation, so more like your blood vessels are opening more at the surface, and so you're losing more moisture when you're taking hotter showers.
Okay, okay, got it. So, almost like the bad part of taking hot showers to, like, open your pores. You're
Yeah.
like okay, got it. Oh,
Mhm.
alright, I might need to turn down the temperature just a
Like
little bit.
like I take really hot like I just like a hot shower, so like I'm just like, oh. I just like make up for it when I get out, or I try to, but
Yeah, exactly. Yeah, and that's such a good point about, like, patting dry, like, not, like, dragging the towel across your skin.
right, right.
Okay, cool. And I assume, like, when and if you shave, like, making sure not to increase irritation that with that too.
Yeah, yeah. Honestly, if you're having really bad, like, sensitive skin or eczema, like, you might not even be able to shave, like, if it's on your legs or wherever, if you're having a flare in that area, it might just be too irritated to do so.
Got it.
If you can tolerate it, yeah. Again, and using bland, shaving creams, things like that. Not like I won't name the brand, but not like the
Yeah.
fun, colorful ones with, like,
Yeah.
the very
Like
black.
pink foaming
Maybe
okay,
just
the ones that smell like strawberries.
right. Aveeno
Okay.
has a shaving cream, actually. You can use that
Oh,
one.
okay. I actually need that because 'cause I'll get into it after I get through all of our questions, but I have a couple of their products and I've tried them. I'm actually, like, pleasantly shocked by how moisturized I felt. I have dry skin.
Yeah,
So, yeah, and like I mentioned, I have sensitive skin, so I always, like, try a little bit, and I'm like, "How's this gonna
right,
go?"
right.
Yeah, their products are bomb, and it's not today, but it's starting to get cold, so I, like, see my skin starting to change.
Mhm,
I'm like,
mhm.
okay, time to like switch up the products a little bit. So very timely.
One, tip if you're trying a product, like, the inside of your arm is a good place to try it because the
Oh,
skin is a little bit thinner. Because you probably don't wanna try it, like, on your face, because then if you have a reaction on your face, that sucks. Um,
yeah.
but yeah, the inside of your arm is, like, thinner skin, so it's usually kinda like a good place to test if you'll be sensitive to a product.
Okay. Yeah, I wish I had that advice like earlier this
We
year.
all learn the hard way.
Yeah, I definitely do. I went to a friend's, like, art gallery in New York, and skin was flawless the entire week leading up to it. Had a full body rash the day of. I was just like, "Okay."
Awful.
Yeah. I think it was also a heat rash too, but I'm sure the products that I was using was not helping. Okay, cool. Next question. When looking for moisturizing products for sensitive skin or eczema prone skin, what are some key features to look for? You mentioned a few, but in case we missed any.
Yeah, I think we touched on a number of them, but, for moisturizer, something that comes, in a pot rather than something that comes in a pump, for, like, those especially dry months, and then things that are bland, so kinda like white or, like, that, like, tannish, like, oat color, and then so things that don't have strong fragrances either, and then things that do have oat are very kind of calming for people who have, like, irritated skin, so that's something to look for too. Um that's mainly it. Those are the
Okay.
kind of basic tips.
Okay, cool. And then figuring out what you're allergic to if you don't have a dermatologist already inside of the arm. I'm never gonna forget that tip now. 'Cause I know, like, our eyelids are also very thin, like, the
Oh,
skin
yeah.
below,
Oh,
and
yeah.
that is, like, when I know I'm about to get a rash, first
Yeah.
place are the eyelids, and I'm like, "Okay, let me go get some ice or something to, like."
Yeah.
Yeah, I don't know, but now I'm definitely gonna try the oat baths too, because if I can, like, stop some of this in its tracks, I'm definitely going to, and oat-based products. I never even thought to read the ingredients, which, like, now that we're having this conversation, sounds like a no-brainer, but yeah.
I mean, most people don't, right? And, like, oh, that's another thing. Um, so even if something says it's fragrance free, that doesn't mean that it's fragrance free. So
Oh,
this is something that I found, like, astonishing when I learned this, but because if a product uses fragrance to mask the scent of something else that's in it, it doesn't have to say that it's a fragrance because they're not using it for the purpose of fragrance.
oh, snap.
Right, so if it like, there are products in the front, it'll say fragrance free, and when you turn it around and look at the ingredients, fragrance will be listed. So
Oh my.
so keep an eye
Okay.
on too, because they're tricky. It's really hard, and, like, that's partly why there's, like, so much, misinformation out there. I mean, it's just, like, it's really hard to know these things unless you, like, are a dermatologist, and this is, like,
Yeah.
all, like, sleep, eat, and breathe.
Yeah, now I'm ashamed to admit I do not currently have a dermatologist, but now I'm definitely gonna get one.
I mean, most people
Um,
don't, right?
yeah. 'Cause I always, like, I'll have, like, a skin emergency, and then I will just wait it out rather than, like, going to seek actual professional care, and then I'll end up repeating the same whatever I did to have the first flare up.
Yeah, I mean, we all do that. I remember I gave myself, like, a burn I, like, burned my face trying to get rid of acne because I thought I would steam it out, so I boiled water and put my head over the water with, like, a cloth, and I just burned my whole face. I was not a
Oh,
dermatologist, obviously. I was in high school, but, like, you know what I
okay.
mean? You just, like, you're so desperate to, like, fix whatever's happening, and, like, it's almost
Yes.
impossible to see a dermatologist, like, within a day, so it's like, I get
Yeah.
it. Been there,
And
I get
even
it.
I feel like when something, like, fully happens to the point where we're ready to acknowledge that we're having a flare up or a breakout, yeah, it's another week before or at least, like, another 2 to 3 days before our skin is even able to go back to normal.
Mhm. Mhm. Yeah.
Dang, okay. We kind of talked about this, but just so that I make sure that I fully understand and our audience fully understands, how exactly do the oat-based products help alleviate the symptoms? I know that they help with, anti-inflammation, right?
Yeah, exactly. So the issue with eczema is you basically have, like, there are a number of different inflammatory markers, right? Because there are like so many different types of cells, and they all what they do. There's something called like an inflammatory cascade. So it's basically like these cells like signal to these cells and tell them to start being active, and then they signal to other ones, and then you kind of get this whole like cascade where you have all this inflammation. And so what they do is they kind of like go in and they kind of signal to these cells to calm down. So oat basically is like calm down, stop signaling, stop signaling. And so it helps like tamper down that cascade. And so it helps break that kind of like vicious cycle of like more inflammation stimulating more inflammation.
Okay. Okay. And potentially silly question. Is it okay if your oat baths are hot?
So same thing. They shouldn't be that hot. Like
Okay.
be warm, but like
Yeah.
the technical correct answer is they should not be hot.
Got it. Okay. So a warm oat bath. That actually sounds so relaxing. Like I kind of might just do it later just because.
I wrote oat baths today, actually, or like as a kid taking them, and they're nice.
Never did. And I'm like, I feel deprived. Like I should have
It's
been in an oat bath.
That's why I took them. So it wasn't for fun. It's because I had chicken.
Dang. Okay. Cool. I do have one more question of my own, but we actually have a lot of questions from our audience. So I want to get through this last one and then we can switch over.
Sure.
When it comes to sensitive skin and sunblock, what are some of the guidelines Black people should follow when comparing options?
So there are two main categories of sunscreen. There are chemical and physical blockers, and so chemical blockers basically go into the skin, whereas physical blockers kind of sit on top. And so when people have an allergy or a sensitivity to sunscreen, it tends to be chemical sunscreens. So and so there's so that's one reason why I personally prefer mineral sunscreens. And then the second is mineral sunscreens actually work better at
Right.
protecting from the sun. So mineral, and when I say mineral, what I mean is their ingredients are titanium dioxide and zinc oxide.
Okay.
And so again, that's one of the things you just have. Sometimes it says right on the front, it's very clear. It's like mineral sunscreen, and it's like, okay, great, it's mineral. And then other times you just have to like look in the back and just verify that it has dioxide or oxide or the names that you're looking for.
Got it. Okay. Yeah, that's good to know because I know the Black community, especially, has recently been branching out into different types of sunblocks because we don't want
Mhm.
that white cast anymore when we put on our sunblocks, understandably so. And I did try Aveeno sunblock, no white cast. Like, I actually really like it, and it's not gonna break. I tried it on my face too, actually. So I will throw that out there for people that are nervous
Mhm.
about putting a sunscreen on that they may or may not have tried before. Because we're still supposed to wear sunscreen every day, even if we are inside.
Yes.
But you won't look like a ghost if you try it. I promise. So yeah. Okay, cool. And are you, besides like reading the label, are you able to tell the difference between chemical and mineral by like looking at it or anything
Not
like that? Okay.
not really. No, because a lot of them, I mean, like I might be able to, but that's because, I've probably tried hundreds of sunscreens and like, you know what I mean? Like, but
Yeah.
because the difference is like so like minerals are a little bit more opaque than
Okay.
the other ones. But even I've like been tricked before and I'm kind of like, oh, and like I flip it back. I'm like, oh darn it. Like, so it's really reading the back is the best way.
Okay, cool. So check your products and mineral is the best way to go.
Mm.
Cool. Okay. I'm going to hop over to some of our questions from the audience. And
Sure.
if you haven't had a chance to throw in any of your questions, you still have plenty of time. So feel free to do that. I'll start with this first one. Can hormone changes trigger hives? Like, is there an example or a correlation between menstrual cycle and hive outbreaks?
Yeah, actually, they can. So, I mean, the list of causes of hives is like so long. Like literally almost anything can cause hives.
Wow.
But hormonal changes can definitely cause hives. And I mean, I would recommend talking to, your OB about that. But there are like certain people that every time they have like their cycle or if they're going through like certain hormonal changes, PCOS, things like that, they can break out in hives as a result. So yeah. Mhm.
Okay. And is that something you just need to wait out or like
It depends. It depends on how bad the hives are, honestly. I mean, sometimes people take over the counter like antihistamines, and then other times, I mean, if you can find the cause, then sometimes there are things that you can try to do to like correct the cause. But when I say anything can cause hives, I mean like anything. Like there's
Oh,
something called pressure urticaria, which is literally like how my elbow's been sitting here, like that would cause a hive.
oh
Yeah.
my okay.
Cold urticaria, if you jump into a cold pool, you like break out in hives. I'm telling you, like anything can cause hives. Mhm.
Whoa, okay. That
Yeah.
would stress me out to
Oh,
no end.
no. Dermatology is crazy.
Yeah, because hives are so painful, like, it's
Well, a lot
not
of them are really itchy.
yeah. Oh, okay. Good to know. So if you have hives, dermatologists, have a dermatologist on hand just in case.
Yeah.
Okay. Next question. For products that come out of a tub, is there concern about contamination from bacteria when we put our hands in to scoop some out?
Mhm. Yeah, so I think, especially if like you have like eczema and there's a risk for what we call impetiginization, which is basically just getting a superficial infection over it. Getting like those like disposable like popsicle sticks, that way you can just kind of scoop it out using that rather than using your hand. You're just using something like a spatula, like not a spatula that you cook with, but you know what I mean, like a wooden little spatula. And that way you're just scooping out with that and then just like kind of like slapping it onto your hand.
Okay. Okay, yeah. That's I actually need to get one because I feel like when you're in a rush too and you're just trying to like make sure you don't leave the house ashy, like you're
Yeah.
not necessarily thinking to like wash your hands
Yeah.
before every
Yeah.
scoop. And we talked about this a little before.
I'm
We
not
touched
gonna
on
lie. I just keep using the same one.
like this is your tub.
I don't share it with anyone else in my head, like, it's only my tub, so, like, and it's
Okay.
out of the shower, so but, like, if it's something you're concerned about, then, yeah, I'm just getting one of those, like, wooden spatulas.
Okay. Yeah. If you have kids too, I feel like it can be hard to sometimes keep things just to
They do.
yourself.
They do not touch mommy's lotion.
Okay, I love that. I literally love that.
They have their own.
Okay. Yeah, and depending on how tall they are, just sit over
Right.
here.
Yeah.
Cool. Okay. Awesome advice. Next question. How can I prevent and treat post-inflammatory hyperpigmentation and scarring?
So, post-inflammatory hyperpigmentation or PIH is like the leading cause why women of color seek a dermatologist. So it's like so common. And like I touched on it earlier, but it's basically whenever there's any level of inflammation for any reason, those melanocytes can get excited or they can be kind of shut down, and that can cause, hyper or hypopigmentation. So, I always say that like treating the root cause is going to be the most important thing. So, for instance, if you're getting that from acne, well, then we need to get your acne under control. If it's because of eczema, well, then we need to get your eczema under control. Whatever it is that's kind of stimulating the process is what we need to get under control first. That in and of itself can help. And then really good photo protection. So, not just from the sun, but from indoor light as well. So, light from your computer, your TV, your cell phone, all of that actually contributes to hyperpigmentation. So that's, another thing. That's another reason why, wearing a tinted mineral sunscreen is a good idea. So that's kind of like prevention. And then in terms of treatment, like honestly, there are some like pretty good, over the counter like fade creams, things like that. But I this is one where I really do think it's a good idea to see a dermatologist if and when you can.
Yeah.
Just because there are other things we do. Like, I mean, there are prescription creams, there are oral prescriptions we use sometimes, peels, lasers. Like we've got a number of tools we can use. It's always hard to treat, but we do have a number of tools that we can tap into.
Okay. Oh, that's so good to know. I feel like every time I've tried to fix it myself, I go
Yeah.
over the counter and then I give up and, you know, wait it out or like I don't even know. Yeah, most of the time just wait it out
Yeah.
if that's even an option. But yeah, if I didn't realize that there were so many tools that have been developed to treat it.
Yeah. I mean, more and more, right? Because our world is becoming more colorful.
Yeah.
And then as a result, like it's kind of like finally, a lot of a lot of companies, even in the cosmetic derm space, are starting to like pay attention to that, and they're like wanting to develop, devices that can help with these things and devices that are safe in skin of color because not all of them are.
Yeah. Yeah, I think I heard that about might have been like laser hair removal. I know I had a lot of friends that were like very concerned about even going to see someone to get hair removed.
Mhm.
But I haven't heard as much negative buzz about it lately.
Yeah. Yeah, yeah, yeah. I mean, so there are 2 main types of, like, lasers. We're kinda this total aside, but one is basically like, yes, it's safe in skin of color, and one is like, no, not really. So that really it's a matter of, like, making sure that you're with someone who knows which one to use and then which settings to use to not cause any scarring or PIH.
Nice. Okay, cool. Another question, how can I make my skin less sensitive?
I don't think you can.
Mm,
Um Yeah, I really don't think you can. I mean, maybe if there's a particular things and like, you can take antihistamines, things like that, but really you're just then like treating the symptoms. You're not necessarily like changing your skin. Like the skin that we have is the skin that we have.
yeah,
And so it's really just a matter of kind of like helping it along, using, like the products that we talked about in this conversation.
got it. And
Yeah.
continuing to protect it.
Yeah.
Got it. Okay. Another question, what is the best sunscreen for sensitive skin? Also, any tips for, I think it's supposed to say for sensitive skin, for people who are getting gel manicures?
Oh yeah. So sunscreen, a mineral one. There are like a number of like brands out there that are like, kind of more like for like sensitive skin. So, and you can find a so definitely mineral sunscreen. And I would say mineral sunscreen that it says it's like designed for sensitive skin.
Okay.
There are a few out there. And then in terms of gel manicures, so it's true that gel manicures, or really any type of like nails can like cause like oftentimes it actually causes like eyelid rashes because like your eyelid skin is so thin. So like, that's one thing that we look for if you're having eyelid issues is if your nails are done or if you get them done. Sometimes it's a matter of changing like the type of product. So if you're getting like just gel manicures and like, or if you're getting like acrylic nails, changing from acrylic to like hard gel or things like that. But if it's really a problem, then you might actually want to see a dermatologist and consider patch testing because they'll
Mm,
be able to test you and see like what it is you're allergic to, and then you might be able to find nail products that you can use that you're not going to be allergic to or have a reaction to.
got it. Okay.
'Cause it all
Yeah.
goes things. Like, sometimes it's like, the, like, sometimes, like I said, it's like the acrylic. Sometimes it's the, I'm blanking on the word. There's a certain thing that's in nail products that, like, sometimes and that's commonly the cause. But, yeah, like
Oh,
formaldehyde. Sometimes you can get, like, formaldehyde-free nail polish or whatever.
okay. Is acetone known to cause issues sometimes?
It can, but I don't think it's on, like, the list of, like, the most common contact allergens.
Got it, okay. Because I know it, like, dries out, like,
It's
every
super
time I get
drying. Yeah, yeah, yeah,
yeah,
like, your hands look, like, ridiculous after you use it, but
yeah, I feel like there's, like,
so
30 seconds
crafty.
in between the acetone and, like, them rushing to put oil on my hand.
I know.
Yeah. Looking crazy, okay.
My nails are done, so clearly, like, I don't
Yeah, there are just certain things I'm really gonna struggle to, like, change. I feel incredibly blessed not to have experienced that yet.
I'm not a
So,
perfect.
yeah, I got mine done for a concert, and I'm, like, in need of a touch-up, so
So am I. I'm going tomorrow, though.
okay. I love that. What about the gloves? I've heard some people wear gloves to, like, protect them from the UV.
Yeah, exactly. The gloves are helpful for the UV. You can actually get like UV gloves that have like, the little like finger things cut out.
Oh,
And that's really just to help. So another like a total aside, but when we look at like how a person ages, like
yeah.
the face is first, but then the next is the neck and the hands. So those are kind of like the dead giveaways of like how old someone is. And you'll notice like some people who like, they'll have their face, like whatever, a facelift, all this other stuff, but then their hands will tell all. So not a bad idea to have them on. Or to put
Yeah.
sunscreen on, like, before you go into the nail place.
Oh, okay. Yeah,
I
not gonna lie, I would probably be that person in a couple of years where they're like, "How old is she?" And then, yeah. Oh, that's so good to know because I feel like we take such good care of our face
Mhm,
because for
mhm.
obvious reasons, we think
Yeah,
that's the only thing.
yeah. It's what if you really care about your face, like, consider your neck and your hands too.
My grandmother used to wear gloves with, like, petroleum.
Yeah, yeah, yeah. Mhm.
Yeah, I don't know if I'm there yet, but I definitely see I definitely
I'm
see
not there yet either, but
where she was going with it. I don't think I could ever sleep in gloves, to be honest, but
oh, no, no.
yeah. Okay. We have time for a couple more questions. Do you have any tips on how to set up your oat baths to maximize the effects?
Oh, good idea. I think just, like warm, tepid water,
Okay.
better than cold water if you really wanted to be like I don't know how people keep the tubs and making sure that the tub is, like, actually, like, rinsed out from anything else that was been in it. Like, my kids are constantly in the tub and, like,
Yeah.
constantly taking, like, bubble baths and whatever, and it just, like, kinda builds up even if it looks clean. So just,
Yeah.
like, kinda doing, like, a quick kinda, like, wash through of the tub, making sure that it's really kinda clean, and I would do that with really hot water, actually, just,
Okay.
like, one of the things that detaches in the tub or whatever. If not, then just using really hot water to kinda clean it out, and then
Yeah.
then drain that all out, and then starting with your warm, tepid water, and then just using, like, a fair amount of oat.
Okay.
Can't
Okay,
really
cool,
overdo
cool.
it.
Yeah, because even some of the cleanings, like, depending on what cleaning supplies you use, like, sometimes it can leave that residue. I
Right,
definitely
exactly.
almost slipped getting into the
Right,
shower.
right, exactly, and it can kinda, like, leach out with really hot water, so that's what I'm saying, use really hot water to clean it out so that, like, all that stuff is kinda, like, gone, and then, fill the bathtub and then add the oat in.
Cool, okay. I'm definitely taking mental notes. Okay. Um, and then can you speak a bit about keratosis pilaris,
Mhm.
and what are some of the best things we can do, for this skin condition?
So keratosis pilaris, most commonly on like the backs of the arms or like the backs of the thighs, and it's basically kind of like what you have is you have like a little bit more keratin around like each hair follicle, so it kind of has like that rough and bumpy feel.
Oh,
There are several like products that will literally say like rough and bumpy, and like that's what they're getting at. And a lot of them have basically chemical exfoliants. So like whether it be like lactic acid or salicylic acid, things that are basically going to kind of like gently like exfoliate that like little bit because that's like I said, that's what it is. Like that, like they're like little keratin spikes almost if you were to look underneath the microscope. And so what it's doing is helping kind of like gently exfoliate that so those little kind of like spikes flatten and soften out. So things that, like I said, a lot of the products like brands will now say like rough and bumpy. And so that, and then if you're looking for specific, or urea, so lactic acid, salicylic acid, and urea are
okay.
three like big ingredients that can help with that.
Okay. I didn't know that that was the official name for it because I've definitely experienced that, and I actually used Aveeno's Tone and Texture Renewing Scrub.
Mhm.
Like, it was so good. I usually am not a huge fan of, like, strong exfoliators or exfoliants
Yeah.
because I just feel, like, dry and, like, honestly, not even that smooth after, if I'm being honest.
Yeah, yeah. Mhm.
Yeah, that I was, like, kind of glowing, still shiny,
I think I just get. I
and
literally have mine right here.
yeah, I think I
Me.
have that one too.
Yeah.
Yeah, exfoliates and hydrates.
Yeah, yeah, yeah. So yeah.
Yeah, for natural skin.
This one I think literally yeah, it says even KP. This one says it.
Okay, yeah, okay, this is the one.
Yeah. So PHA is a polyhydroxy acid, and so that's like that's like a really gentle polyhydroxy acid is like having a moment right now because it's a really like sensitive exfoliant. So it's good for people who, want an exfoliant but also have sensitive skin.
Yeah.
So yeah, this one has PHA in it. So or this one.
Ooh, okay. Oh, love that.
That
Yeah.
wasn't even planned. That just happened to me.
Yeah, I'm like,
I didn't even know someone was gonna say that wasn't even planned.
yeah, I literally was like, "Hold on, because I have no idea what KP was. I
Mhm.
saw it on the bottle and I was like, "Oh, this feels nice," but, like,
Yeah,
okay, got it. Like,
yeah.
cool, cool. Okay. Um, Next question. What do you recommend for exfoliating when you have sensitive skin? Which I feel like we just answered, but if you have any other tips.
Yeah, no, I would say, like, polyhydroxy acid is definitely, I would consider that. I would not use anything that has, like, really, like poor St. Ives. I feel like St. Ives gets dragged a lot, but, like, don't use St. Ives, like, that apricot scrub, those, like, really there's basically, like, exfoliating with, like, pebbles. Don't do that. I think, like a gentle, like a microfiber towel is fine.
Ooh,
Some of those like rougher loofahs, probably not so much because what you're doing with those is you're basically creating like small little micro tears. And so with every little micro tear, you're just like, again, kind of breaking that skin barrier. So you're increasing your
oh,
chances of being exposed to something that's then going to cause like, a flare or cause your sensitive skin to not be so happy. So like if you wanted to exfoliate, I would use a chemical exfoliant rather than a physical one. And when I say chemical, I mean something like a polyhydroxy acid or a PHA.
okay. What about the African bath nets? I think that's what they're called. They're gaining popularity,
Mhm,
although the Black community has been using them.
mhm.
But, I heard that they're supposed to be, like, more gentle than a loofah and supposed to store less bacteria or something like that.
I don't have one, so I would have to honestly, like, feel one and see, because it's like they all have different it's kinda like sheets, right, in terms of,
Yeah,
like, how soft they are, how, like, kinda rough they are, so it's kinda similar, but I don't know. I'm not that keen on physical exfoliants when people have particularly sensitive skin.
got it. Okay. On the safe side.
Yeah.
Oh, I love this question. Can hair products impact sensitive skin?
Oh, they sure can. And oftentimes, so when you think about a hair product, like you have to think about like it's not only coming into contact with your hair, right? Like it's coming into contact with your hands. It's coming into contact like when you sweat or whatever, like onto your forehead, down your neck. Even like your depending on how long your hair is. Like, I mean, my hair is constantly touching other parts of my body.
Mhm.
And so, it's not like you can't say, "Well, I don't really touch it or I don't put it on my skin, so therefore it shouldn't cause a problem," because hair products absolutely can contribute. And oftentimes when people have allergy to hair products, it's not their scalp that they have a rash, it's other places on their body because the scalp is super thick. So the scalp tends to be like less bothered by hair products than like other parts in your body.
Yeah, when I first started my natural hair journey, I think it was like 2 years ago
Mhm.
now, worst breakouts and rashes and hives I've ever had in my life, and I thought it was maybe just stress, and then I
Right.
went through the mental checklist. Okay, what did you actually change product wise? It was just layers of natural hair products that I'd never used before. And like, I went through the whole curly bang
Yeah.
phase. So, like, my forehead was just hating me, to be honest. Yeah, definitely got like really bad rashes behind my ears and like down the back of my neck. I was just like, okay, maybe less is actually more and I should use different or, like, less product, but
It's so common, and another thing, like, I feel like there's, like, this misconception that if it's natural, then it's better,
yep,
and my response to that is like, "Well, poison ivy is natural."
real, real.
Right? Like,
Yeah,
you can still have an allergy to something just because it's natural, like,
yep,
I mean, and then that's not a knock on natural things, it really isn't, but it's just like, I mean,
yeah,
that doesn't mean you're not allergic to it just because it's natural.
yeah, yeah, that doesn't mean you should be walking around with it sitting on your face like a
Right,
mask, pretty much.
right.
Yeah, yeah, I won't even take us on the tangent because we don't have enough time for that, but about, like, the natural face mask that you can buy from random places, and
Yeah.
then you just sit there with it on your skin and hope that
Lots
when
of
you take it off in 10 minutes, you look like a different person, but
there's a
yeah,
lot of things out there.
yeah. Okay, cool. I think we have time for maybe one more question from the audience. Um, what do you recommend for people in menopause struggling with dry skin?
Yeah, so, all of us as we get older, we have something called natural moisturizing factor, and we lose that as we get older. And then through menopause, estrogen actually helps keep moisture in our skin. So as we start to, go through hormonal changes, whether that be perimenopausal or postmenopausal, that also contributes to dry skin. And so, I mean, if you can tolerate like having some periods where you like, you do that like slugging where basically you're using petroleum jelly, in certain area. If it's your whole body, then I mean, you could put petroleum jelly in your whole body if you wanted to. But putting like a thick moisturizer on and then putting petroleum jelly over it actually can be really helpful just because it
Oh,
helps occlude it. And so it helps it kind of like get in there. A lot of the tips that we talked about, hydrating more than you probably used to is going to be necessary. So hydrating more, and then same thing, those tepid water, or not as hot water, moisturizing more frequently. So it's a good idea to moisturize, after you take a shower, and if that's in the morning, and then also, again before bed. So moisturizing 2 times a day rather than maybe once a day, and then using things like if you can tolerate it, using petroleum jelly.
okay. Oh, I'm so glad that I asked that question. I'm not in menopause yet, but even the slugging, I would do the really thick petroleum jelly first and
Mm.
then my other products.
Okay,
And
so it goes
yeah, it did not work. So now I know
no,
why.
put the petroleum jelly on last, and that's generally true in anything. You start lightest to heaviest.
Oh, okay. Yeah, I was doing it very wrong. I need to get a dermatologist.
I think
If
you
we have learned nothing else from tonight, do not
right.
assume that you know what you're doing when it comes to your skin. Got it. Okay, I'm very excited for my entire skin routine to change based on tonight's
I'm excited
call.
for you.
Yeah. Cool. Okay. Well, that's actually it for the questions that I had from you. Um, yeah, I'm just really appreciative of this time. I know that you're extremely busy, but I really appreciate you sitting with us for this rapid fire of skin related questions.
It's fun.
Uh, yeah. So thank you again for your brilliant insights. And once again, I really, really want to thank Aveeno Skin Visibility and their initiative for sponsoring tonight's conversation. Together, we hope to break down barriers for Black people whose lifestyles are interrupted by the effects of sensitive skin. As a part of our collaboration and knowledge share, oh, sorry. As a part of our collaboration, and knowledge share and resources about skin conditions and eczema care for thousands of consumers of all ages, Aveeno is sponsoring 500 premium Health and Her Hue memberships. So you can become a member today. And as a reminder, premium memberships include unlimited access to thousands of medical providers across 60 specialties, including dermatology, unlimited access to our community where you can interact with peers and medical professionals, unlimited access to our content that centers you and your lived experiences, unlimited access to our event series that covers a multitude of health and wellness topics like tonight, and priority sign up for our virtual care squads. You can find out more information at healthandherhue.com. Be sure to check us out on social media and stay up to date on events, content, partnerships, and more. We have another next week. Thank you all for joining, and make sure that you check out Aveeno's products. I absolutely loved them, and there's a lot here tonight that can help with sensitive skin and eczema. They are tried and true, dermatologist approved, and they are here to help you with all of your skin conditions and concerns. Thank you all, and have a good night.
Thank you, everyone.